Good morning, everybody. It's my pleasure to share with you some ideas and investigation about the health risk in the underground space, with a focus on two major issues which concern air pollution and the pandemic. And we will try to see how the smart technology will help us to address these challenges. First of all, the question is that why should we care about the health risk in the underground space? If we look to the underground space today, it's largely used at the end of 2017. We had every day about 160 million passengers, a lot of people. And in some subways, such as Beijing and Shanghai, every day we have about 10 million passengers. And in London and Paris, we have about 5 million passengers. It means that only on the subway, we have a lot of people every day in this space. Now, in this space, we have some risk for the health, one which concerns the air pollution. The noise also is very serious in the underground space. Also the question of natural light, lack of natural light. We don't have enough natural light, mainly for people who stay long time in the underground space. And this year, we have this big problem with the pandemic. In my presentation, I will focus on air pollution and on the pandemic. Let's look, first of all, for the air pollution in the underground space. This problem is considered today as a large public health issue. Look to this cover of magazine and newspapers in Paris, London, and New York. They speak about the risk of the air quality in the underground space. That's why today this problem is considered as a large public health issue. Now, what is the composition and why the air in the subway is so dangerous? If we look to some data from London subway about the concentration on PM 2.5, you can see that the concentration is very high. It's about 600, to be compared to 10, which is the limit imposed by the World Health Organization. And if we look to the composition, you can see in the subway, it's mainly from iron oxide. At the surface, you can see that the level is very low when we compare it to the underground space, and we find mainly organic carbon. Then is that mainly we have iron oxide. And if we look to the origin, in the same station, if we look to the variation, the daily variation of the PM 2.5, we can see that it has a very good correlation with the number of trains. When we have a lot of trains, the PM is very high. When we have little trains, the PM is very low. And it's almost all over the week. It means that this PM pollution is mainly created by moving components. Mainly it comes from wheels, brakes, and so on. Now, what is the impact of their air pollution? Some data show that the pollution and the air pollution in the subway is about 8 times more toxic than the outside air. And also it could cause some DNA damages. That's why it has a very important impact on cardiovascular diseases, lung cancer, pulmonary diseases, and asthma. It's really very serious for the human health. That's why generally we international organization and have set some limits for the PM level. For the PM10, who imposed or gave the limit of 20 as an annual mean. The European Union, it's twice. For the PM 2.5, which is more dangerous, the level is about half. It's 10 and 25. We have some data from different regions in the world about the PM level. You can see that's really very high, and about the compliance rate according to WHO standard. You can see that globally, only about 15% of the subway station respect the WHO standard. And it's mainly in Europe where the level is much lower, it's about 10%. Could be attributed mainly to the fact that the subway in Europe is much older than that in other areas. From Paris, we have also some data about the concentration of PM 2.5. You can see in the substation it can reach also high level when it compared to the outdoor. Globally, we have something which could be in the underground about 30 times higher than what we have in the outdoor. And this result also confirms what we have shown before. What are the factors which impact the subway air contamination? First of all, we have some factors which are related to the subway station. The depth is important, the age, the design, and also the use of what we call the platform screen doors. The subway vehicle, which is at the origin of the contamination, what are the type of brakes, the wheels, and also what about the cleaning of the vehicles. We have also some operating condition. Ventilation is very important. The frequency of vehicle is very important. The cleaning is also very important. Let's look to the impact of the station age. We have some data from Shanghai subway where we compare the PM level in new station and to that in old station. You can see the level in new station is less than half of what is in the old station. It means that the age of the substation has very important impact on the PM concentration. Concerning the depth, we have some data from London subway where we have here the level of PM with depth in all of these areas. The depth is larger than 20 meters, means that we have deep station, and here we have low depth station, and you can see that the concentration increases quickly with depth, because for deep station the ventilation is much more difficult. That's why we have this effect of depth. Now, what about the methods which are used to reduce the air pollution in the subways? We have different methods which are related to the ventilation, filtration, use of filters, use of platform screen doors, and also the question of cleaning using high pressure. Let's look to the efficiency of these methods. If we look to the ventilation, in some substation we use what we call the piston winds, the movement of air which is created by the train movement. Tests have shown that this effect has very good performances to reduce the air pollution, but mainly in wide station and double tracks. And also we know that this effect is very interesting to reduce the energy savings. For the mechanical ventilation, we have also some data from the Korean subway, which show that it's efficient for PM10, not for PM2.5, not for small particle. And the small jet fan, also we have some results which show that we have also they could be very efficient for the PM10, but their efficiency decreases with the decrease in the PM size, means that they are not good for PM 2.5 or PM 1. Now, we know that today we use more and more artificial intelligence for the ventilation. We have also some results, we can find them in this paper, which show that we have very important improvement in the air quality. Then this one is really very interesting to have to use the AI to control the ventilation. And also they are very good to reduce the energy consumption, which is very energy intensive. We take the Beijing subway station, about 64% of the energy consumption is used by the ventilation. Now for the air filtration, we have some tests also about large particle PM10, show that both single layer and double layer give good results also. But we don't have good results for the PM2.5. Now, if you use some station use also magnetic filter, mainly for iron, and they showed that they have good performances for PM10, but also for PM2.5. It's a good result. Now, what's about this platform screen doors, which separate the train from the substation? We have also some results which show that we have very good effect on the station platform. It reduces by about 50% the PM2 concentration. But it has a negative effect because it increases the PM concentration in the tunnel, because the PM stay in the tunnel and in vehicle. And this increase could be really very important. Here we have some data from Beijing substation which uses this technology. And you can see that if we compare the indoor and the outdoor for the PM2.5, we have almost the same result, which means that these doors are very efficient to reduce the air pollution with the PM concentration in the substation. Now, for the high pressure cleaning, we have also some tests in Taiwan, which show that we have important decrease in the PM10 concentration, about 50% and 30% in the PM2.5 concentration. That's why today we have a very good market for the air cleaning in the subway station. You can see that the global market is about $15 billion, and it's mainly in Asia Pacific and in Europe. And this one is really very interesting for professional. Now, let's go to the second part, which is about the pandemic risk in the underground space. We know we have some data which show that the public transportation has high risk for pandemic spread. First of all, because we have a lot of people, as we said, and the space is confined. We have some difficulties to control the access and to identify potential contaminated people. And also, we have a variety, large contact surfaces in the ramps, doors, or opening system, and so on. It's very difficult to control all of these surfaces. The COVID had very important impact on the subway traffic. Let's look to the situation in London. In March, the subway has the full capacity, but with the lockdown, the capacity dropped to 5%, only 5%. And after it recovered with the unlockdown, but up to about 40%. You can see that the subway did not recover its initial capacity. And this one, you know that we have real problem for the income of the company which operates the London subway. If we look to the mobility, the impact on the mobility in London, in the city of London, you can see the buses also suffered from the COVID, but less than the subway, and we had very important development of the bike, which is considered more safe for the mobility. We have also some data from New York. You can see also we had very important drop down to 10%, and after it recovered up to 30%. If we look to the data for the bus transportation, it dropped only to 22%, and it operates better than the subway, and it recovered up to 55%. The question that, what's about the future? Could we really be optimistic for the underground post mobility? We have different issues. First of all, we know that with the COVID crisis, we had a reduction in the mobility demand because of smart services such as e-services, such as administration, health, education, and people now they don't need to move to use the mobility. They can do it at home. The same thing for work. And also we had very important development in what we call smooth or active mobility, such as walking and bike. Then globally, we have a reduction in the mobility demand, and this one could be very interesting, mainly to reduce the peak demand for the underground space. Second thing, we had some interesting result from the observation that the COVID risk is contagion in the public transportation is low. These studies, we have some studies from Austria, France, Japan, New York, and Singapore, which says that if we take preventive measures, the risk of the contagion was low in the public transportation. In France, also we have some data which show that only 1% of the COVID clusters are linked to public transportation. We have also some data in London subway which said that there is no evidence of COVID in the subway. All of these results are really very encouraging. It means that we were more pessimistic in the public transportation than the reality. We also, the pandemic created some innovation in the underground mobility. First of all, if we can, about the question of material which are used in the subway or in the underground space. We have some tests which show that the virus survived for more than 3 days on plastic and stainless steel, but less than 4 hours on copper. It means that we can change some materials in risky area, and some company proposed to detect using the camera what they call the hotspot surfaces which are largely used or touched by people. And these surfaces, when they are detected, to use adequate material with low time virus surviving. Other companies worked on what we call the flexible design. Question that how we can make the underground space and also vehicle more flexible for ease adaptation to the demand, because we expect a rapid change in the demand, and also if we can propose new services. We have also innovation in the hygiene and safety standards, such as the use of thermal and optical sensors control the access of walking and areas. The question of how we can organize social distancing, and also about surface disinfecting. The smart technology with the EUT, AI, mobile application, cameras, augmented reality are very useful for the observation, to understand what is happening, to give real-time information, for tracking, to enforce guideline respect, about to develop some contactless services, and also, as I said, in the ventilation. If we look to China response to COVID pandemic, all of these technology were really used and implemented. It's very interesting. And if we look to the result, sure, with other measurement, can see that in China, the daily contamination in the first wave was only about 5,000 a day, and we didn't have the second wave. If we look at the situation in US and in Europe, you can see that the daily contamination for the second wave is about 300 or 200,000 to be compared to 5,000. Then means that this technology could be really very interesting to reduce the daily contamination. Now, in both in Europe and in US, the government bought a lot of money for what they call the pandemic economic recovery plan. It's mainly to the economy, but some amount are also used for the innovation and for sustainability, green technology, and so on. Then here we have very good opportunity. These projects are considered as the most important in the history of the EU. And today we have a lot of money from public power in order to develop some innovation and to fight the pandemic and to develop the economy. We have also today very important progress in pandemic fighting and treatment. We have different vaccine. We improve the treatment. We have also more precaution. If we look to the scientific research, which is related to the health in the underground space, you can see that in the 19th we had very little concern. This concern now is increases, and in 2020 we have about 50 papers in Web of Science, and the year is not finished. I think that we will have more. It means that we will have more and more research in this area. Finally, what we can say about these important issues. We know that the underground space is really subjected to high health-related challenges. We have the air pollution, the pandemic, but we have also other things which have very important impact on public health. Today, it's a question of public health, but also it has very important impact on the economic model of the underground facilities. When the underground loses a lot of passengers, the question of the economic model of the subway, which could suffer, and the question that we have less money for the maintenance, the development, and so on. And this is very serious question here. It's not only about health; it's about the operation, the existence of the underground facilities. Now, we have some opportunities. I said that we have good progress today in pandemic fighting and treatment. We have a lot of innovation in the design, ventilation, and so on. We have, in some countries, a massive economic recovery plan, a lot of money, and also see that we have today an increase in the public acceptability for urban disruptive change, and we know that the acceptability of public could be a barrier in the innovation implementation. This one is also very important. For all of these factors, I think that we can be optimistic for the future. Thank you very much for your attention. I would like to thank Professor Xie and all the team for the organization of this